do the recording. Okay. So you said for people, they should be swallowing instead of sublingual. For
for GI issues, specifically inflammatory GI issues like irritable bowel syndrome or IBS, ulcerative colitis, UC, Crohn's disease, it's better that they ingest it or swallow it. So there's more of a local kind of lining effect on the bowel system. And for them, the full spectrum is going to be better because although that big class of diseases are considered more of an autoimmune type issue. So the full spectrum will be better for them.
Okay. Oh, that sounds good. Okay.
Mm-hmm. And then, of course, Soluvi for the glutathione.
That's what I had mentioned too.
Mm-hmm.
I was gonna actually ask you, but you read my mind.
Yeah.
Okay. Yeah, because I told them about that, the Soluvi. I go, the Soluvi repairs your cells from the inside out. I go, and it's helping a lot of people with that.
Yeah.
I go, and then the CBD oil, I told them, like, I'm not sure which one would be better for you, if it would be the CBDA or CBD oil itself.
Mm-hmm. Yeah. So the full spectrum, that'll be better for him.
Okay.
Mm-hmm.
All right.
Exactly.
I'll let them know.
Yeah, and then the last one would be the Super 7, again, just to help boost the immune system.
Immune system. Okay.
Yeah. Very cool.
So Rita has some good news, Dr. Phillip. Rita, can you let Dr. Phillip know?
When should I start with?
With all of it.
How about the gooder news?
Okay. I don't know which one's better. All right. We had talked about my my questionable use of lamotrigine.
Oh yeah.
For my heart. Well, I just went to see a cardiologist.
Mm-hmm.
And he said, now, let me give you some history. When I was a kid, I was told I had an innocent heart murmur as a result of scarlet fever.
Okay.
Then in my 30s, I guess, I was told it was, as technology progressed, I was told it was a mitral valve prolapse.
Okay.
Then about 25 years ago, I was told it was mitral valve regurgitation.
Okay.
This cardiologist studied my latest echocardiogram and said there's absolutely nothing wrong with my heart.
Wow. That's like miraculous.
Yeah. There's no reason for me to be on any medication, and I don't need to keep seeing a cardiologist.
Awesome.
Yeah.
Awesome. Yay.
Yay.
Congratulations.
Yay.
And the other thing is that my A1C dropped a little bit again.
More?
I'm down to 6.0.
Wow.
Yeah.
Awesome. Awesome. That is great.
Yeah.
That is great. And refresh my memory, where did you start on your journey with your A1C?
Oh, the highest it's ever been was 13, I think.
Woo.
Maybe 12.
Oh,
but in August, in mid-August, it was 6.5, and then it went down to 6.1, and now it's 6.
Wow. Awesome. Awesome. That's great.
Mm-hmm.
That's great. Yeah. Those are the things we like to see.
Yeah. I'm a tough old lady.
No, you're not. You're in your prime. You're in your prime. You're not old.
I don't know.
So seriously, back to the cardiologist. What did he say? I mean, how do you explain? So a little bit of. So did the cardiologist ever say what prolapse and regurg and all that means?
Different cardiologists throughout the years have described it different ways. The prolapse was described to me as that when the valve closes, it flops open for a fraction of a second again.
Yeah.
Regurgitation was explained to me as that some of it backs up a little bit. Some of the blood backs up between the chambers.
Yeah.
Yeah.
So anatomically, the valves kind of open inward.
Mm-hmm.
So prolapse means that the valve doesn't open inward. It actually, when the chamber below it is under pressure, it kind of folds out. So that's what's meant by prolapse. So instead of the valve opening and closing this way, it gets under so much pressure and the valve is so weak that it unfolds the opposite way. So my understanding of regurgitation means that, and especially if you have prolapse to begin with, that means that the valve wasn't really closing this way. It was probably closing kind of this way. And then the regurg means that it was constantly open and never really closing. So that's what I mean. It's really it's beyond remarkable, Rita. It's really miraculous.
Doctors tell me I had a classic click.
Yeah. Yeah. Because what happens is when the valve prolapses, the valves are meant to go inward and they're kind of stiff. So when they are forced outwards, they literally kind of click because they're forced outward. So that's what I mean. It's beyond remarkable. It's really miraculous that the valves have healed and they're now working the way they should be. That's what I was asking, what did the cardiologists say about it?
This guy seems to think I was misdiagnosed in the first place.
Wow. How do you misdiagnose that on an echocardiogram? It's a picture. Yeah. Yeah. I mean, it would be as if you took your car into the auto mechanic and the front end wheel alignment was off and the wheels were always pulling to one side and then nothing happened. You bring it in the next time and the wheels are in perfect alignment.
Yeah.
I mean, it's a mechanical miracle.
Wow.
Cool. Then I'm quite fortunate.
No, you're blessed.
It's
not fortunate. Yeah, God has more things for you. That's why you're not old.
Well, I don't know how much longer I want to go. It's been a long road.
Dr. Phillip said 120 years.
Amen.
Oh, well, then I only have 10 more to go.
You are not 110.
I know. Tell me about
There are days.
Yeah. Well, that's awesome. That's awesome. Very cool.
Yeah. I'm excited.
You should be. You should be.
So, Dr. Phillip, for the A1C,
Mm-hmm.
the CBD oil is the one that's it's helping people lower their insulin levels.
Yeah, so it's helping to create that. So, and this is the really hard thing for most people to fathom. The endocannabinoid system is everywhere in the body, and it interacts with. I don't want to say. I don't want to overstate and say it's every cell,
Okay.
but it's certainly every organ system. And because every organ system is involved, and then that means indirectly every cell is involved. So the endocannabinoid system helps to kind of create this homeostasis or kind of a balance, if you will. And by doing that, it helps out with the pancreas to work better. It helps out with the uptake of blood sugar at the cellular level. So by doing that, you're going to reduce the insulin resistance, which means that whatever insulin you have floating around, it's going to work better. And by doing that, now your body becomes more efficient, and because of that, then your A1C and your corresponding blood sugar should drop.
Okay.
Yeah, you would like to say that it's a direct cause and effect. You know, like classic cause and effect is the injectable insulin, right? Your blood sugar is high, you inject some insulin, and your blood sugar drops. I mean, that's a direct cause and effect. The endocannabinoid system is not like that. It's an indirect modulator, or an indirect kind of balancer, if you will.
Okay. That makes sense.
Yeah, that's exciting.
It is. Because I know, when did you start the CBD oil, Rita?
When did I start it?
Mm-hmm.
Beginning of August.
The beginning of August, and then it dropped to a 6.2. Is that correct?
6.1.
6.1, and then now it's 6.0.
Yeah. Mm-hmm.
And you had it at what was your level beforehand?
Actually, before I went into the hospital, it was 6.0. And then it went to 6.5 while I was there.
Okay. So from a 6.5 to a 6.1, now 6.0. Is that correct?
Yeah.
Okay.
And the remarkable thing about that is that A1C, and what that stands for is hemoglobin A1C. And it's an extrapolation of a molecule that's tied to hemoglobin. Hemoglobin is within the red blood cell. The red blood cell lifespan is about 90 days, or about 3 months. So the reason why typically A1Cs are checked every 3 months is because on average, that's how much time is needed for the red blood cell population to completely turn over. So that's why they check the A1C, which is tied to the hemoglobin, which is tied to the red blood cell, every 3 months. So the fact that you've seen a difference in 6 weeks is huge. So it'll be interesting to see what happens after all the red blood cells turn over, and to see where you're at.
I got a call yesterday saying that since I had 3 A1C tests in a short period of time, I probably will be billed for 2 of them.
Yeah.
Doctors didn't coordinate.
Yeah. Hopefully, if the laboratory has any ethics, it doesn't charge an arm and a leg for them, because it's a really simple test that we do in the clinic. So it shouldn't be that expensive of a test. So, oh, I lost my train of thought. No, I was gonna. Oh, I know. Are you still checking your blood sugars?
Yep.
And what's your morning blood sugars like?
They're high 120s.
Okay.
And by 2 hours later, they're low 100s.
Okay.
Did I say
And that's the only
2 hours later?
Okay. That's the only thing that doesn't really make sense, is because an A1C of 6, if I'm not mistaken, correlates to about a 110 average, if I'm not mistaken. So I'll see if I can look that up real quick. Because that fasting blood sugar doesn't seem to make sense. So I have to see if
Endocrinologist thinks I have the dawn phenomena.
yeah, that could be. That could be. So it looks like I didn't memorize my charts correctly, because an A1C of 6 corresponds with a average blood sugar of 126, depending on who you look at.
Mhm.
Okay, yeah, so I guess it fits then, 120s. Okay. Okay. Cool.
I'll take it.
Yeah, oh, absolutely. Yeah. Yeah, no, that makes perfect sense. Just checking one other source. Yeah.
Hey, Doc, I've checked like 3 of them. They say a 6 is a 135.
Yeah, so I guess it might depend on which chart you use.
Yeah, I mean, I've looked at 4 different ones now, and it's 135, 136, but none of them say anything lower than a 135.
Let's see if we can find something by the ADA, the American Diabetic Association. That would probably be maybe the most reproducible. And so I can't find ADA, but WebMD, which is supposed to be credible.
I've got the Diabetes Council,
Yeah, that's probably pretty good.
and then that one says 135.
Hmm.
Jovi, I have a bunch of these charts that I keep on my phone. I can send them to you.
Yeah, you can send it to me. That'll be good.
When I first started this whole venture, I wanted to see where I was and everything. So.
Okay, so here's the American Diabetic Association. And they say an A1C of 6 is 126.
Oh.
So anyway, the whole idea is lower the better. So it's all good. So Rita, did you ever do a reverse T3? Does that sound familiar?
Doctor says I don't need it.
Yeah, okay.
Of course he does.
Yeah. Okay.
I pushed for it, he won't budge.
Yeah. Okay. The only reason I mention that is depending on, so let me ask another question. What time do you usually check your blood sugar?
Check it when I get up in the morning, usually around 8:30.
Okay.
If I work out before I have breakfast, then I check it again before I have breakfast.
Okay. So the reason why I was asking is cortisol, which is really the test that you need, unless you have a really outside the box thinking type of physician, they're not going to order that.
Mhm.
Reverse T3 is kind of a way to back into that, because if your reverse T3 is not optimal, then that means that your adrenal glands may not be working as well as they can. And the thought is that the dawn phenomenon is because of the adrenal glands aren't working as well as they could, and your cortisol levels are off. So that's why there is really a big dip in your blood sugar. And then the body is trying to recover from that big dip, because usually everyone, even if you're going through something called, so there's 2 types of adrenal issues. There's adrenal fatigue, which means that the adrenal glands are kind of getting beat up. they're not working as well as they could, but they're still producing some cortisol. So for those people, usually their cortisol level is normal in the morning. And by morning, usually it's anywhere from 3, 4, 6 a.m., somewhere in there. And because of that, that really drives blood sugar down, usually lower than what most people would be. So then the dawn phenomenon is the body saying, holy cow, blood sugar is way too low. Let's back off on the cortisol, back off on insulin, and let's let the blood sugar kind of bounce back. And that's the dawn phenomenon, is that kind of bounce back. So in some ways, that's kind of good news, is because individuals that have adrenal exhaustion, that means the adrenal glands are burnt out and they're not producing as much cortisol as they could. There's not even a bump or a bounce in the cortisol. In other words, you're sleeping and there's not enough even recovery or regeneration in the adrenal glands to produce cortisol. So you're not even getting a bump. So as a result, there's not that big dip in the blood glucose level. And then there's not the corresponding holy cow, it's too low, and then it goes back up. So that kind of is a backwards thinking into, yeah, so you probably got some adrenal glands that are doing something, so that's good. And so all that to say, long story short, is that the dawn phenomena is going to be that temporary rise, and then maybe your 2 or 3 hour postprandial or 2 or 3 hour after you have a meal, that may be a little bit more indicative of what your usual kind of blood sugar is.
That's usually where it's they're about normal.
Yeah.
Sometimes a little higher or lower, but about normal.
Okay. Yeah. So the good news is at least your cortisol levels are probably good at least once in a day. You're supposed to have 2 spikes, if you will. So at least they're good once in a day, and that your adrenal glands aren't exhausted. They could be a little bit fatigued, but at least they're not exhausted, burnt out, or however you want to refer to that. So kind of some good news. So you're just full of good news.
I am.
So I have a question, Dr. Phillip, because I know Jim is having, like he had a spike in his sugars this week. But I was mentioning if there's any stress going on in your body, if you feel sick or just stress in general, that normally spikes up your sugar levels, doesn't it?
Yeah, and it could be either physical stress, it could be even emotional or psychological stress. Yeah. Because again, getting back into the adrenal glands, depending on when you check the blood sugar level, depending on when your stress event was, the adrenal glands could put out a lot of cortisol. That drives the blood sugar down. You may not be checking the blood sugar at that time to see that the blood sugar level is lower than usual. And then what you're measuring is the holy cow, my blood sugar is too low. And then the body kind of rebounds. So in the morning, it's called the dawn effect or the dawn phenomenon. And then if you have that same kind of thing in the late afternoon, early evening, which is the second kind of spike when the adrenal glands are supposed to come online and cortisol level is supposed to be given, it's called the Smoji Effect. And it's probably after some guy, sorry, it's supposed to be politically correct, some person that found this out and then named it after themselves.
Oh, okay. Yeah, because I know when we were starting like with Lupe, that's when I started noticing, because I would ask her several questions. I was like, well, what did you do today? What happened? That's when I noticed when her sugar levels would either spike up, either if she had any stress or if she worked out for whatever reason. Sometimes it would go up, sometimes it would go down. So all depending, like even when she would get sick and stuff, that's when I started noticing the numbers too. So
Mhm.
that's why I had that question too in reference to that. Because I've noticed whenever something's going on in their bodies, their numbers either spike up or they drop like drastically, either or.
Mhm.
But that makes
So
sense a lot.
yeah, so the drop would be the cortisol effect, and you're checking the blood sugar right at that point. The spike could be, like I mentioned before, you kind of miss the cortisol effect and drop, and then the body is like, holy cow, my blood sugar is too low, and it's kind of the rebound. The only thing that doesn't make sense is the blood sugar dropping after exercise. Or excuse me, your blood sugar spiking after exercise. That doesn't make sense, because you're engaging the muscles. The muscles want to use the circulating blood glucose, the circulating sugar first. So you would think you would see a drop all the time. I'm gonna have to do some research to find out why you would see a spike.
I do notice sometimes when some of the people are working out and they're fasting and then it spikes up instead of dropping. I know Christopher was saying that it was the sugars, the body getting all the sugar out, I believe, or something like that.
So yeah, so the whole idea of fasting is to utilize the circulating blood sugar. And then once that's depleted, which means I guess your blood sugar level could go down. And then once the body realizes that it needs energy, the next source is the stored sugar in the liver called glucagon. So now the body says, okay, we need something else. So then if the glucagon is dumped, then I guess that could cause a rise in blood sugar. And then it should theoretically go down again. And then your body still needs energy if you're still exercising. And that's when you go into ketosis and start burning fat. So I guess that could explain why, depending on where you're at in your exercise and where you're at with using circulating glucose versus stored glucagon. Yeah, okay.
Oh, okay.
Mine always rises after exercise.
So it would be interesting, Jim, to, I mean, if your fingers can spare it, check your blood sugar, and I'm assuming you don't have a cutaneous continuous glucose monitor, correct?
No.
Okay, so yeah, it might be kind of interesting to check your blood sugar right before, maybe about 20 to 30 minutes in, and then if you're still exercising, about 45 minutes or 60 minutes.
Okay.
If you want to be a little lab rat.
Well, I could try that, except Chris has me on a limited exercise where it's 30 minutes. But I could do before, then do the 30 minutes, but then I always take my dog for a long walk, so then I could do it after the walk.
Okay. So what's his thinking behind the limited exercise?
So the 30 minutes, I know he that's what, like, how do you call it? So we don't mess up with our I can't think, Rita.
I don't,
I'm like,
I don't know
Rita.
where you're going with this.
I was like, with our hormones, so it won't affect our hormones. So he does limit us to do the 30 minutes up to 45, the max. So
Okay.
at least it burns the fat. So we do the high intensity workouts and also the weights, but we're only limited to do a workout of 30 minutes to like 45 minutes the max, no more than that. And
Okay.
I used to work out 2 hours before I met him. I would do 2 hours of a workout. And that's what my personal trainer would always tell me to do. And I wouldn't lose weight. I wouldn't budge. I know I was working with one personal trainer for like 6 months and in those 6 months, I only lost 5 pounds. And when I started with Christopher, the first week, I lost 5 pounds. So, and that was with the way he taught me how to do the workouts and just working out the 30 minutes.
Okay. I'll have to touch base with him. Okay. I've not heard about limiting. Everything that I've read is that 30 minutes seems to be the sweet spot of where you kind of kick in an accelerated metabolism, and then that accelerated metabolism then will burn more fat calories for, I think it's like 6 hours or 8 hours afterwards, something like that, extended period of time. So I've heard minimum of 30, like maybe 30 to 45 is kind of the sweet spot, especially if you're doing HIIT, high intensity interval training, then you really don't need to do anything more than that. So I'll have to touch base with them to see what he's thinking.
Yeah, because I know normally for the HIIT, it's normally 25 minutes to like 30 minutes. That's the max that we've done. And it's helping me. Like that's how I lost the weight. You know,
Yeah.
I lost the weight within those 2 years. I'm down to 125 pounds. So I lost those 125 pounds, in other words. But because of the HIIT workouts, and then I do incorporate weights maybe 2 to 3 times a week, and that's the max, you know, that I've done. I know I can increase it a little bit more. I know he did mention that, but I've kept it to just three times a week because I work out 6 days out of the week and just have 1 day as my break.
Okay. Yeah, so it sounds like no matter what, you're hitting the sweet spot of 30 minutes, and you're also doing the high intensity interval training. So you're doing everything you should do in order to try to accelerate your metabolism for the rest of the day. That's one of the reasons why I really try to encourage people to do their exercise in the first part of their day. And I phrase it that way because I have people that not only work days, but they also work swing or even graveyard shift. So I always tell them, if you can, try to get your exercise in the first part of your day after the longest sleep period.
Yeah, normally I do my workout maybe, it can be from 4:30, 5 o'clock. So that's when I do my workout.
Okay.
And then I won't break my fast until lately I've been breaking it like around 11:30 or 12 o'clock. And then there's some days that I'll break it at 1 o'clock. Okay.
Yeah, as long as it's not disturbing your sleep cycle, then, and it sounds like your body is tolerating the 4:30 workout. Yeah.
Okay.
Yeah. So on a side note, are you hitting potholes and that's why the camera's jostling?
Yeah. You know, there's potholes in Chicago all over.
Yeah. I heard there's 2 seasons in Chicago, construction and non-construction.
Yeah, construction's right now.
Yeah. So Jim, did that seem to kind of help out?
Well, yeah, I mean, it's for me more or less. I've learned that stress has been really affecting me lately. My work, which is physical, like you say, the physical stress, and I'm going through a lot of problems with my daughter right now. So that would be my mental, and it's been, and I don't know, I just haven't been feeling great at all this whole week. Just due to all that.
Mm-hmm.
My numbers, I think it peaked at 145, which isn't that bad, but I mean, yesterday, that was yesterday, and then it was a 104, 105, and I think was a 107 again today. So, I mean, and then I haven't tested it again because I got a couple more phone calls from her. So I haven't tested it since then. I don't want to.
Yeah, I would cut your losses and stick with the 104, 107.
Yeah.
But his numbers are still good. And that's what I've been mentioning to him. It's going to affect your numbers, especially with the stress. And I've noticed that. Or if I know if they get any colds and stuff like that, I've noticed that too. Like their numbers start changing a bit.
Mhm.
So I just didn't want him to worry too much on that note, because it's gonna go up, and down too. But I wanted him to at least, hear it from you too.
Yeah. I have one patient that has an autoimmune disease called Lichen Planus, and she's on the full spectrum. Unfortunately, her dermatologist has her on 30 milligrams of prednisone a day. So whenever she takes the prednisone, it spikes her sugar. However, when she takes the full spectrum, it lowers her blood sugar. So she's really happy about the full spectrum. Overall, she's feeling better. So she's going to talk to the dermatologist and say, hey, can we kind of cut back on the prednisone?
And what is the prednisone? Is that how you say it, Dr. Phil?
Yeah, prednisone is one of the old-time classic steroids that's used for any type of inflammatory issue in the body.
Okay.
And lichen planus is a condition where you get abnormal kind of skin eruptions or skin lesions, and it can be literally anywhere in your body. Classically, there are these kind of white patches in the mouth, and that's how it's usually first diagnosed. And that's how it's diagnosed in this patient.
Okay. That makes sense.
So of course, the knee-jerk reaction for the dermatologist is just throw some steroids on it, and see if he can just try to put a wet blanket on this big fire.
Oh, okay. Yeah, I know when I had allergies, they would always give me steroids for it to at least open up my airways.
Mhm.
But since I haven't had those issues,
Mhm.
I haven't had any steroids. It's been a couple years already
Mhm.
with that.
Were you hospitalized for your asthma?
When I was here in Chicago, I know 4 years ago, I almost died because I had pneumonia. I had walking pneumonia, and it was, they couldn't tell that I looked sick or I was sick. So they were able to, they hospitalized me for 5 days with oxygen and stuff like that. And they gave me steroids, the whole 9 yards. So that was an experience where it was like, it was a hard experience, but a good experience at the same time. So I do appreciate it.
Yeah. The reason why I was asking is that individuals, and it's usually youngsters, that have frequent asthma attacks, that either get hospitalized or wind up in the emergency room, they're usually given steroids repeatedly. And then those individuals later on in life have a higher incidence of either hip fractures or spine fractures because of either osteopenia, and then that goes on to osteoporosis. So we're always a little bit more proactive or more cautious for individuals that have had bad asthma in the past, because the bone density may be affected.
Oh, wow. I didn't know that.
Mm-hmm. Yeah.
So I know with the asthma, when I got here to Chicago, I started having my inhaler. Started using an inhaler once I came here to Chicago. So I wasn't sure if it was because of the pollution. I know in Texas, they would give me shots just to open up my airways, but it was because of my allergies. So I'm not sure. I know that I stopped using an inhaler. It's been 3 years, about 3 years. Yeah, since I started Kayani, I know with that product, I no longer needed to use my inhaler.
Yeah.
And
So
that
the
was
fact
because
that
of the
you're
nitro extreme.
okay, the fact that you are getting shots in Texas for your allergies, most likely there is a steroid in that. So typically, our kind of general rule of thumb, and there's never been any studies on this, but we try to limit steroid shots to maybe 1 or 2, or at the very most 3 a year. And this is in the orthopedic literature, where you're given an injection into a joint, and then theoretically, it's not being widely distributed through the body. Whereas for you, for allergies, they usually give you the shot in your arm or in your bum, and that's getting widely distributed. So that means you're, again, more prone or at a greater risk for osteoporosis, and then possibly hip fractures or spine fractures.
Oh, wow. Okay. So should I get that checked, Dr. Phillip?
So, Jim, you might want to close your ears. You're not menopausal, right?
No.
Okay. So as long as you have circulating hormones, then that means that you probably have enough estrogen around to stimulate and maintain bone health. So that's why it's really important for women that are still going through their menstrual cycle to make sure that you're taking all of the bone building stuff, because you have hormones around in order to help maintain that bone density. You're going to lose a little bit, no doubt, because your hormones are going to naturally decrease over time. So anything you can do to maintain your bone health and your bone mass while you have specifically estrogen floating around, that's going to be the better thing for you.
I have noticed, and I was going to tell you this, Dr. Phillip. I know my cycle's changed, and I've been getting my cycle almost every 15 days. So I'm not sure what it could be. I know that they checked all my hormones and everything was normal. So I was gonna go back and get that tested. I wanted to because I know I was taking a pill that Dr. Grija gave me. So I wanted to just check maybe if it was that was affecting it. And then go back maybe like in 3 months to see or check, like keep a record of my cycle at least for the next 3 months and see where I'm at too.
You know what the pill is that she gave you?
I don't remember. I would have to check.
Okay. So I don't remember seeing anything in the literature about CBD accelerating the cycle or I don't remember seeing anything about that.
Okay. But this happened just recently. So I'm thinking because of my daughter going to school and everything like changing with work and stuff like that, I think it's stress.
Mm-hmm.
So I'm thinking it's
Yeah.
that. I'm trying to relax a little bit and meditate and stuff. So I'm trying to see if maybe it's affecting me because of that, because of the stress itself.
Yeah, absolutely. Yeah, stress will definitely do it. Yeah.
And then I wanted
other
to check
interesting-
my iron levels too, just in case. So.
Yeah, unfortunately, as you increase the cycle, you're going to be increasing the blood loss, which means that you're going to be losing iron. Yeah. So the other interesting thing that they found through research, and they actually found this or kind of surfaced in sororities. It seems like through at one time they were called pheromones. I don't know if that term is still used or not, but it seems like women in sororities would all kind of sync up, and as a result, they would all commonly start having their cycle at the same time. So there could be, especially when you mention things about at the bank, there could be kind of like this undercurrent of stress throughout your division, and you all are acting like a little sorority and kind of recycling everyone.
Oh, I see.
So in other words, ask your friends at work what's going on, how they're doing.
Yeah, I don't
Sorry,
know.
Jen.
I haven't checked that. Well, I'm not that close to them, so.
Oh, okay. Yeah, you don't want to.
That's the only thing.
No.
So I'm not sure if we're all sinking in. Maybe.
Yeah.
I know because I would sink in with my daughter.
Yeah.
So I'm not sure. You're right. I haven't checked or I haven't asked.
Yeah, that's
So-
not like an icebreaker kind of conversation.
It's kind of weird. Yeah.
Yeah.
And then we got a new girl in too. So I was like, and I'm always the one that's always ahead. I don't know, like I started off, in other words. So maybe, yeah. I never thought of it.
Mm-hmm.
Yeah, because there's 4 of us.
Mm-hmm.
Yeah, you're right, Doctor.
Yeah.
We'll see.
Okay.
I'll ask. I'll ask.
Okay, Jim, I think we're done.
Hi, Dr. Phillip. How you doing?
I'm doing well, Bertha. How about yourself?
I can be better. I'm a little better now. I had a question. They had to put me back on an Una boot.
Oh, okay.
Yes, they did it yesterday.
Mhm.
I went to see the vein specialist yesterday because I know it had opened like a month ago. And those veins were bothering me so bad that they were swollen and really bruised up.
Mhm.
When I went to the wound care, because I saw that it opened slightly, I told I made an appointment for the wound care, and the doctor's like, "Oh no, don't worry, Bertha, this should be healed in a week." And I'm like, "No, doctor, I think you guys should put me on an Una boot because I know my body."
Mhm.
He's like, "No, Bertha, you don't need to be on it." So they were bandaging up my foot, and which I didn't really like. But I'm like, you know what? If he's a doctor, he should know better, whatever. Well,
Mhm.
for the past 3 weeks, I've been in so much pain, especially with the vein and then the wound. The wound didn't get big, and I think it's everything because I'm taking like the vitamin C, the Celluvi, everything. So it's small, but it wasn't healing. And I kept noticing it. I'm like, this is not healing.
Mhm.
So then I went to see the vein specialist yesterday, and he told me, he's like, why don't they, how come they didn't put you on an Una boot, Bertha? They should have done that from the beginning. And I told him, I go, that's exactly what I said. But nobody ever listens to me. So I went off on that doctor, and then I went off on the wound care doctor because I'm like, you know what? You're not listening. You're not listening to the patients.
Yeah.
You should be listening. I told you from the beginning, this is what I wanted you guys to do, to put me on an Una boot. And I go, so 3 weeks has passed. I've been in so much pain. I haven't been able to do anything because it's so, I mean, my leg just hurts. My whole back hurts, my hips. So I've been in a crabby mood.
Sorry
So,
about that.
yeah.
Yeah, I don't know why they wouldn't use an Una boot. I mean, it's such an old time tested technique. Matter of fact, in my own clinic, another provider had seen an individual with a diabetic ulcer and was just doing what's called a wet to dry dressing, which means it's just a sterile pad with sterile water. And the whole idea is to keep the wound from drying out. So this way the skin edges can approximate. And so that provider was out. I ended up seeing him, and I was thinking to myself, why the heck isn't he on an Una boot? So put him on an Una boot. I saw him a week later, and everything had reduced by 50% just in 1 week. So it's really an old treatment. It's a really low tech treatment, but it works very well.
Yeah, so that's what I told them at the beginning. I just don't know why they didn't listen. So now today actually is the first day that I'm not feeling so much pain. I mean, I'm in pain a little bit, I guess, because it's tight. I mean, it's not tight, but for me, because of, I haven't had a Nuna boot for a while, it's my body's not used to it. So it's like, oh man, but they tell me elevated and everything. So I'm elevating it right now. And then I don't feel it so tight. So
Where's the Una boot at? What part of the leg?
it's the whole, it's on the left side. And so it's from the toes all the way to the calf.
The Una boot is?
Yeah.
And where's the wound at?
It's on the side, on the left side, the outer ankle.
Okay.
Right there in the middle where the, in the ankle part where there's, that skin by the Achilles. Yeah, right there.
Okay.
So then he also told me, Dr. Phillip, that I might want to think of getting a laser ablation or something like that. The doctor said it's either they would burn it, close it, or strip the vein, but they would have to see which vein it is, because he says that we have, of course, a lot of veins in our legs. Is that a good idea to do?
So the classic reason for doing any type of vein procedure is for something called varicose veins. And those are the kind of big tubular structures that look like an earthworm underneath your skin that kind of pop out. So most people do it for vanity. Rarely is it done for pain because of something called superficial phlebitis, which means that the blood pools in the vein because the valve isn't working. So going back to Rita's example, in the veins, the valves are opposite. They point towards the heart. So what happens is the blood goes through up towards the heart, the valve closes so that this way it doesn't pool down below. And you have many of these valves at different segments in the leg so that this way the blood doesn't pool and kind of collect. So if that valve doesn't work and doesn't, let me get my hands right, doesn't shut, then that means then you have a compromised valve and then the blood is going to pool below it. And then that dilates the vein and makes it look more like an earthworm or a tube or something like that. So with superficial phlebitis, the blood is collecting there. And then as it collects, that can irritate the vein, or sometimes you'll get a little bit of a clot there, and that's painful. So for those reasons, then you have to do something to block the blood flow through the vein. So the old way was literally what they called stripping the vein, and that is they would literally tie off the vein at both ends, cut it, and then literally pull it out. So now you would have no blood flow through that area. The newer techniques are using some type of energy. So it could be laser, which is typically used now. In the old days, it was kind of like a heated probe. So you essentially cauterize it or cause the vein, because of the heat, the vein shrinks down and then no blood flow goes through it. So it sounds like if your problem is venous stasis, which means the blood flow is just kind of collecting and stays there. That's what stasis means. And because the vein is so close to the surface of the skin, that area of the body has notoriously poor blood supply to begin with. So then the pressure on the skin causes it to erode, and then you get the ulcer. And then it's just a vicious cycle. You have constant blood backing up in that vein, it erodes through, it doesn't heal, and you have to go through the slow healing process. So that's why doing some type of vein procedure probably is a good idea.
Is it? Okay, because he told me I have an appointment with him again in 2 weeks, so we can talk about that. But I did tell him, I have sickle cell. So remember that, because these doctors seem to forget I have sickle cell. And I tell them, they're like, you know what? If you guys not read the records, or do you not read my records and say, oh, wait, you're a sickle cell patient? So he's like, oh yeah, I forgot. I'm like, oh my God.
Yeah, I don't think that would alter a vein procedure.
Okay.
Because you're essentially closing off the vein. So I don't think that would alter the healing response from the typical laser energy source type of procedure. So you should be okay.
Okay, so if they close it off, Dr. Phillip, where would it flow? I mean, because
Yeah, I know. Good question. And that's what everyone else always asks. Well, if you take away that pipe, then how is blood going to get back?
Yeah.
Your body has so many collaterals, which are kind of extra channels. And surprisingly enough, the body is really, I'm sorry, it's not surprising. It's the miraculous adaptability of the body. So you'll develop collaterals. So the body will develop these other little channels to get blood back to the heart, or the other channels will kind of compensate.
Okay, but then will it, if I do that, would it be less, of course, painful, but then my ulcer won't continue opening? Is that what the doctor explained like that to me? Is that correct?
Yeah,
Oh,
yeah,
okay.
because you're gonna take away the vein where the blood is pooling, and then that pooling blood is putting pressure on the skin,
Yeah.
and then the skin is eroding through. So if you take away the underlying pressure or cause, then theoretically you shouldn't have any more ulcers.
Okay, yeah, because I know he did notice too that he says it was just sitting there. And because it was like swollen, my whole, like by the ankle and a little above it, it was always like swollen. It was like burning, like a burning sensation in my skin. I couldn't touch it. So it's like, I don't know why, but like he said, he goes, I don't know why they didn't do this from the beginning, Bertha. And I'm like, well, I don't either. But like I said, I told them. And the doctor's like, no, you don't have to, Bertha. This should heal in a week. I'm like, no, it's not. But I'm like, okay. Being because doctors,
Yeah.
but that's why I'm just like, oh man, I don't know what to do anymore. Doctor, I mean, I was in the point that I was so much pain. I'm just like, I can't, and then with this weather change here in Chicago, of course, it was hurting even more.
Yeah. So the only thing that sounds a little bit unusual is that the Unabut is typically a medicated wrap that's put over the site of the injury or where the healing needs to be done. Whereas with you, it looks like they also use it as kind of like a compression wrap, and that's why they started at the toes and worked all the way up the leg. So this way it helps to push blood out of the leg. So if for some reason, and you can just do a really quick chest, all you have to do is just push on your big toenail, and when you press down, it'll blanch or get white. When you release it, it should pink up really quickly, like less than 2 seconds. And if it does that, then your blood flow is okay. If it doesn't, then that means that the wrap may be a little bit too tight. So you can loosen it a little bit and then make sure that your blood flow is okay. And then if you need help with reducing the overall swelling, then you can put something like an elastic wrap, like the old ACE wrap, on top of the Unabut in order to have that be the compression and not the Unabut.
Oh, okay. Well, then I'm gonna do that. I mean, it is kind of tight, but I'm elevating it right now. So
Your toes aren't blue, right?
no,
Okay. I'm
no.
just like, you're okay.
And I keep telling my daughter, check my toes, and she's like, no, Mom, you're fine. And I'm like, okay, it's just, I don't know. I guess because back at it again, I'm just like, oh, so frustrated because it's like they didn't listen to me for the past 3 weeks. This could have been healed,
Yeah.
So
Sorry about that.
yeah, that's why I'm just like, and I told the doctors, I'm like, you know what? I guess I'm not doing your job right, but okay. So I don't know. I'm just like, hopefully, and like I said, I was trying the CBD oil, I was trying the cream, and none of it was working. I was in so much pain. I mean, it would work for a little bit, but pain again. Like, oh man. So yeah, so I'm like, okay, well, I gotta talk to Dr. Phillip then and get on the Zoom so I can ask him if that's a good idea to do, do that surgery. I'm thinking about that now.
It sounds like that would be the better way to go.
Is that okay? And another thing, I mean, because of my hemoglobin's low, they said it was 8.2. Could it be because my platelets are low too? Maybe that's why it's not healing properly.
Platelets being low would be more. What was your platelet level?
Well, I know the hemoglobin was 8.2.
Okay.
And I don't remember the platelets because when I went to the lumbar, the one with the science, they told me, they're like, Bertha, have you thought of maybe platelet transfusion transfusion? And I'm like, they never told me about that. So, I mean, if that's going to work to heal my ulcer, I'd rather do that than the surgery.
Well, unfortunately, the platelet infusion is just temporary.
Oh, okay.
Yeah, whereas the surgery is permanent.
Oh.
And most people, let me rephrase that. Most sickle cell individuals are going to have a low hemoglobin, just because the red blood cells are irregularly shaped, so they're going to naturally kind of destruct or self-destruct more frequently.
Oh, I see.
Mm-hmm.
So then the surgery, I guess it's the surgery then, huh?
Yeah.
Now,
Yeah.
how is the healing process if I do end up getting the surgery? I mean, would I have to still I wouldn't be able to walk, or you don't know, Dr. Phillip? Or
So usually it's an outpatient procedure, and usually the only thing you have to do in follow-up is just wear a compression stocking for a period of time. And I think it's typically like 4 or 6 weeks to maybe a couple months, something like that.
Oh, okay. And then, but how would they do the surgery? I mean, do they have to put me under or locally, or how do they do this?
Yeah, it's usually local.
Oh, is it?
Mm-hmm.
Okay.
Yeah, it's usually local, and it's usually outpatient in like a vein clinic.
Right. Okay. Okay. Well, I'll let you know what happens then. I mean, I know I have to see them in 2 weeks because he says, he wanted to just go, make another appointment so we can talk about it.
Okay.
And everything and see what we decide. He's like, you have to decide, Bertha, because you're the one always in pain. He's like, but we need to make sure we're going to do another test to see if that's the cause. Because there's 2 veins he saw that they were swollen. It was swollen and bruised up.
Mm-hmm.
They need to know which is the one that's causing the ulcer to open.
Yeah, usually it's the vein closest in proximity to the ulcer.
See, that's what I thought. And I told him, I go, it's this one. And then he's like, hey, you sure? I'm like, yes, I know it's that one, because that's the one that hurts me the most.
Mm-hmm.
So he's like, okay, well, we're gonna have to do some test. I don't know what other test they have to do. And they find out.
Yeah. So have they ever done a dye study?
No.
Yeah, so most likely it's either going to be, so the most invasive is a venogram, where they put a small needle in the veins of your foot, and then this way they can actually track and look at which vessels are the biggest and what's the course of the vessel. The other way is doing an ultrasound, which is non-invasive. And what the ultrasound shows is that the vein and the valves aren't working. So it depends on what they're trying to look for. If they're trying to map out which veins they're going to potentially have a procedure on, they might lean towards the venogram.
Okay. All right. Well, when I go on 2 weeks, then I'll let you know. So
Yeah.
that I don't know. I just want to, your opinion and see if it's okay or it's not, or, I don't want to do it and then have the same problem again.
Yeah.
Because it's very, very painful.
Yeah.
So
no, I get it.
Okay, Dr. Phil. Well, thank you very much.
Oh, you're welcome. You're welcome.
So Dr. Phillip, I know that.
Hello, everyone. Hello.
Oh.
Hey, Alice.
Hey, Alice.
So Dr. Phil, I got good news too, though. I got one person to sign up from the UK.
Wow. Awesome. So you're my second person overseas. I've got one gentleman in Italy.
Cool. I think Alice is also talking to a couple of other people.
Very cool.
Say that again.
That you're talking to some other people as well. For the CBD oil. Can you hear us?
Out to her and tell her that her 10% is going to end soon if she don't get in there and get something.
I didn't hear you.
Oh, I say I gotta tell that person from overseas they need to go ahead and order something before they lose the 10%.
Oh,
yeah.
absolutely.
Yeah.
Yeah, within the first 2
She
days,
has
or
to
first
order
10
it.
days.
Yeah. So, and then the other person too. So, but I did get someone, so I'm happy, and I'm talking to 5 other people as well.
Very cool. Yeah, let us know how to help you out.
Of course, if I'm at work, I'm just going to tell you, please go talk to them people, and I can keep working. Dr. Phil, you know I don't do no work. You know I'm lazy.
Ay, Alicia.
At least you're honest, Alice.
And that's what they're there for. I come on and I just give it up to the upline. Take care of it for me. There you go. Dr. Phil gonna kill me, so is Divana, but it don't matter.
I'll talk to them, Alice.
Okay.
Send them my way. And I'll sign them up.
No, I am. Closer. You're the closer. You're the closer.
Yes, ma'am.
Yeah. I gotta go in and take people their food now. I'm back off. I'll be listening.
All right.
Okay. Thanks, Alice.
I don't know who that is.
I think it's Jim.
Yeah.
There we go.
I was like, I think it's Jim.
Yeah, I'll mute myself again. I'm in the middle of a downpour right now.
Where you
Right.
at?
I actually just drove up to Northbrook.
Oh, okay.
That's over here too, as well, in Carpentersville.
Wow. Okay.
I'm shocked Joby doesn't have the rain yet.
No, it's just getting dark.
Oh, is it? Okay, you're gonna get it.
Yeah. It's getting dark over here.
Good deal. So anything else we need to cover?
I think my end, I'm good. I don't know if anyone else has any questions.
Since I'm in perfect health, I have no questions.
Yeah, you got a new heart.
I know. Isn't that amazing? She's got a healthy heart.
Yeah. Amen.
And I've had 2 heart attacks.
Really?
Oh, wow.
Yeah, first one when I was 27.
Why?
Irregular heartbeat.
Wow.
Yeah.
That's really unusual. Okay.
So I do have a question. I forgot to ask you.
Uh-huh.
Now that you're talking about the heart,
Mhm.
I know when I had the walking pneumonia and I was hospitalized, they did tell me that I had an enlarged heart. And I
At
asked my
the-
mom, I asked my mom if it was because something when I was younger, but she doesn't know.
Mhm.
So would it be because of the pneumonia?
So it could be, and it could be transient because of when you have a pneumonia type process, sometimes fluid builds up in the lungs. And as a result, there could be increased resistance of blood circulating through the lungs. So that could kind of put more stress on the heart, and then the heart could temporarily enlarge. But unfortunately, just having the term enlarged heart doesn't really give you a lot of information. If it truly was a chronic issue, they would have probably done something more in follow-up, like a follow-up echocardiogram or minimally a follow-up EKG or something like that.
They did do that.
And
That was like 4 years ago, and I had my doctor review it, and he said it was fine. It was just that it could have been because when I was younger, I had an enlarged heart or something like that. Or it could also been because of the pneumonia itself that it looks enlarged. So I didn't get to follow up or do anything else from that. But I just remembered when you were telling Rita in reference to that.
Yeah. So if you have any type of studies, whether it's an echocardiogram, a chest X-ray, EKG, something like that, shoot it my way. Let me take a look at it.
Okay. I'll look at it. I'll check my my doctor's information, and I'll find out.
Okay, cool. Very cool.
Thank you.
Yeah, you're welcome. You're welcome.
So anyone else has any questions?
I'm all good.
Very cool. Very cool. Good deal. Good deal. Okay. Same time next Friday?
Same time next Friday.
Cool.
Thank you so much, Dr. Phillip. We greatly
Yeah.
appreciate all your information.
Yes.
Oh, you're very welcome. You're very welcome.
Thank you very, very much.
You're very welcome.
I know we were talking about that yesterday, that we're real blessed to have you.
Oh, thank you. Thank you. I appreciate that. And if you have any questions, Jovi, tomorrow, I'm around all day. So
Okay.
just let me know.
Okay.
You too,
Yeah, I'm
Alice.
free tomorrow. So I'm going to be cutting a couple of videos tomorrow.
Cool.
And start posting it on the magazine part of it.
Very cool.
And then
Very cool.
I'll probably be posting a couple of our videos also on the reversing type 2 diabetes. And I'm doing a couple of other little things for tomorrow. So I'm catching up with a few things since I'm off. Because next week I'm working every day again. So.
Wow. Okay. Okay.
Okay.
Good deal. Yep. Well, I'm here to help you. Just let me know.
Okay. Thank you so much, Dr. Phillip.
Good deal. Okay. Y'all have a great weekend.
You too.
You too.
Okay. Thank you. Bye-bye.
Bye. Bye, everyone.
Goodbye.
Bye.
Bye.